Hello everyone, my name is Dr. Natasha. I'm a qualified GMC registered and NHS practicing doctor. I have 15 years of teaching experience in the UK. I have taught various medical students across the world and with a very positive feedback, and people were very happy with my teaching. But because of my commitment with hospitals, my teaching job was a bit stopped. Not stopped completely, because I'm still teaching at hospital setting to our medical students. The purpose of this channel is to help, and is to make the teaching content available at your own convenient time, and so you can revise and consolidate any topic which you like. Today I have chosen cellulitis. Let us start. Cellulitis is an acute bacterial infection of the dermis and subcutaneous tissue. It is presented as hot erythematous and spreading rash, and it can be accompanied with systemic features such as fever, malaise, and nausea. What causes it? There are two important organisms, Streptococcus pyogenes and Staphylococcus aureus. These organisms, they are responsible to cause cellulitis. There are other less common causative organisms as well, which include Pseudomonas aeruginosa, Vibrio vulnificus, and etc. And the other ones are sometimes people, they keep pets like cats or dogs, so because of their bite it can cause cellulitis. Human bite injury can cause cellulitis because of the Echinella corridans, and Streptococcus pneumoniae and H. influenzae. So these are all organisms, but the important ones are the two which I have mentioned before. How to diagnose it? In order to make our diagnosis, we have to take a short and very accurate history, and that should include the local and systemic feature. You need to ask about fever, malaise, pain, skin changes, and any previous history of cellulitis, any use of antibiotics, their occupation, their hobbies, and if they have any pets at home, and risk factor, for example, diabetes mellitus and peripheral vascular disease. This should be the part of your history. When you examine the patient, so I will be showing some pictures which will help you to see the cellulitis cases, how they look like. So this is on the dorsum of the foot. This is red and inflamed, and you can see it's a well demarcated area on the thigh. Here it is. It's this one looks too much inflamed, and the last one is on the dorsum of the hand. So while examining, there are few things that we need to keep in our mind, but it's not always hard and fast that you will find the cellulitis only in legs, which is very common in legs, and one leg is involved. Bilateral leg cellulitis is a bit rare, and it is presented as red, hot, swollen, and tender skin that spreads rapidly. The margin which I have shown previously, it could be diffuse border or a well demarcated edge, and sometimes in a complicated cases it comes up as blisters and bullae. Furthermore, inflamed regional lymph nodes and pure orange appearances, you can find these symptoms as signs as well. Examine for an obvious skin break, such as wound and macerated skin, fungal infection. While examining, always palpate for fluctuance, which shows underlying abscess. Assess for underlying risk factors, for example, leg edema or lymphedema. And we need to monitor the vital signs as well, like a temperature, pulse, blood pressure, respiratory rate, and that's how we can monitor if the patient is ill or is normal. And we need to exclude differential diagnosis as well. Next. After examining and history taking, the question comes up, do I need to do any investigation or send any blood? So the short answer is no. Routine investigation with suspected case of cellulitis, we don't do it. However, if there is any break in the skin or any punctured wound, then we need to do swab for microbiology, as we have discussed in the previous slides that some organism can be the risk factor, and they can cause, like Streptococcus pyogenes and Staphylococcus aureus. Sometimes people who are systematically ill or have comorbidities, then we need to do full blood count, ESR, CRP, urea and electrolytes, and liver function test. Sometimes to exclude other conditions, we need to do further investigation. The conditions could be DVT, septic arthritis, and acute gout. In order to manage a patient, we need to keep these classification and some scoring in our mind. I will talk about one by one. First, I'm going to discuss Eron classification of cellulitis, which is also according to our NICE guidelines, UK. And Melbourne Asset score is also available to help us to guide whether to start antibiotics or oral antibiotics or IV antibiotics. So here we are actually going through Eron classification of cellulitis. You can see that class 1 systematically well with no comorbidities. Class 2 is systematically unwell and poorly control comorbidities. That's actually class 2. So obviously for this case, we need to start antibiotics. Class 3, large surge response or very poorly controlled comorbidities. And if a patient is in shock or come up to the hospital in a life-threatening condition, that's actually class 4. So we need to follow the sepsis guidelines. So this is Eron classification. The next one is scoring. Scoring is also important to guide you for the management. The ASSET actually is the abbreviation for this. So A stands for area. Less than 1% body surface area affected, score is 0. More than 1%, score is 1. If systemic features are present, then 1. Not present, 0. If there is soiling, mild, 1. Moderate or severe, we give 2. If there is no soiling, 0. If eye involvement present, then score is 1. And if it is not present, then it's not involved, 0. Tenderness, none, 0, mild, 1, moderate or severe. So overall scoring for ASSET score is 7. So why this is scoring and why this Eron classification, why we need to keep this in our mind so that we can quickly assess the patient and make our own clinical judgment so that we can decide this patient needs oral antibiotics and this patient needs IV antibiotics. If your score is less than 4, then you can see then we will treat the patient with oral antibiotics. If the score is more than 4, then we will commence IV antibiotics. These are the references I have used, and this is all about for this topic cellulitis. However, there are some sections which I will be covering in my upcoming videos. Thank you so much for your support, and stay tuned, subscribe my channel, and I will be posting more informative topics to help you guys. Stay tuned. Thank you so much. Have a lovely day. Bye bye.